Welcome to Indian Healthcare Resource Center of Tulsa. The mission of Indian Healthcare Resource Center is to provide quality, comprehensive health care to Tulsa Indian people in a culturally sensitive manner that promotes good health, well-being, and harmony. And for the last 37 years, we've done just that. Since its founding in 1976, the Indian Healthcare Resource Center of Tulsa has been an integral part in the Tulsa community and has been committed to improving the health of Indian people living in the Tulsa area. IHCRC serves a large intertribal population comprised of members of over 160 federally recognized tribes.
Indian Healthcare Resource Center began in 1976 when a couple of teachers and counselors in the city of Tulsa, they worked with Indian pupil education, and they were having a lot of problems with the children not coming to school and the parents missing work because they had to go 30 miles from Tulsa to Indian Healthcare in Claremore. And at that time, there were no services specifically for Indians. So a grant became available from Indian Health Service about that time, and these two individuals applied for that grant, received it to do a study for the city of Tulsa to see what services were available and why Indians were not using those services for the adults and for the children. We started looking for funding to start an outpatient clinic in the city. And so we were able to get medical equipment from World Medical Relief, which was a medical equipment from World War II. And we were able to get a little office on downtown and opened up an exam room, and we had a doctor a half a day a week. And from that, we went into being able to hire a full-time physician, looking for funding any place we could find it.
In 1977, direct health care was first offered, and IHCRC moved from 31st and Sheridan to a downtown medical office building located at 8th and Denver. The Women, Infants, and Children Supplemental Food and Nutrition Program was added the same year by means of a contract with Cherokee Nation. In 1978, Indian Healthcare Resource Center was incorporated as an Oklahoma nonprofit organization, and in 1979, we moved again, this time to a two-story, 12,000 square foot facility located at 9th and Cincinnati in downtown Tulsa. In 1980, mental health care was offered for the first time, and so began our integration of medical and behavioral health services.
The integration of medical department and behavioral health are important. At this facility, part of our mission statement is talking about providing integrated care, and I believe very strongly that we as human beings are integrated beings. You know, there's the spiritual and the physical, the mental, and the emotional, and those all act in concert with each other. And so it's important that we pay attention not only to our physical health, but also to our emotional and psychological well-being as well. And there's a large interplay between those two. If our physical health is impaired, that can have a great impact on our emotional and psychological well-being. The same happens the other way. If we are depressed, then we're less likely to eat well and to take care of our bodies, to exercise, to sleep well, and that's going to affect our physical well-being as well. A lot of community mental health centers and other mental health facilities don't have the luxury of having the medical doctor right there or the dietitian right there. And one of the things that we frequently do here is if we have a patient that we're working with, then we can go directly to that provider and sit down at the table together to discuss the care of that patient and how we're going to make sure and treat that patient in a holistic manner.
In the early 1980s, we added dental services as well as a community garden program that emphasized nutrition education and economic self-sufficiency. Computerization arrived in 1982, and with that, so did our first quality programs. Shortly after, X-ray, optometry, and hearing services were added. With the 90s, we started offering mammography services and opened an in-house state-licensed pharmacy. In 1991, we held our very first Dance of the Two Moons fundraiser, Held annually, this event raises funds that are put towards our pediatric programs and throughout the years has afforded thousands of Native American children the opportunity to attend sports and cultural camps that otherwise they would have never experienced.
Our Health Education and Wellness Department has two major components. We do a youth prevention component out in the community through a summer camp program. We had 10 weeks of summer camp this past season and 300 children participated. They learned about diabetes prevention, culture, health promotion, fitness, and good nutrition.
In 1995, the Oklahoma Healthcare Authority launched a new Sooner Care program, providing health coverage to children. With it, our ability to bill the state for services and generate more funding to put back into our programs.
When I joined the Indian healthcare team in 1996, I walked into the end of the planning for the new facility. So I was in the building at 915 Cincinnati, not quite 2 years. And during that time, we were very much involved in trying to get our patient business office up and running and stable so that we could make our house payments. When we first began billing Medicaid, we had such horrible time getting our first claims paid. And I remember very well, it was just me and one billing clerk. And we had about 300 claims that we needed. And we'd send them in and they'd send them back and say, fix this. And so we went through that for about 3 months. Carmelita, the patient business office biller, and myself hand carried 300 claims to the Oklahoma Healthcare Authority and sat down in the lobby and said, yeah, we're not leaving until these claims have been corrected and accepted. And once and the head of Oklahoma Healthcare Authority came out to the lobby and with a bottle of whiteout and sat with us till we got them all fixed.
When an organization is starting out, it is struggling, and that has been Indian Healthcare's motto, which is, give me a challenge and I'm going to turn it into an accomplishment. And so in the beginning, it didn't have the most beautiful facilities. It may not have had always the best equipment, but it made do and really made the community's health status improved. It continually reached out regardless of whatever it did.
In 1998, IHCRC expanded its diabetes prevention program with the benefit of a national multi-year grant from the Indian Health Service. The expanded diabetes programs help patients better understand and manage their diabetes and to learn the special care and nutrition requirements imposed by the disease.
Here at the clinic, we have dietitians and a nurse case manager and a counselor case manager who work with our patients. We have over 800 patients who have diabetes, more who have prediabetes. Additionally, we work with patients who have hypertension, hyperlipidemia, all kinds of different things. We see the prenatal patients for nutrition education. And our team works very cohesively with the medical staff to provide that kind of wraparound service to help the patients learn and understand how to take care of themselves and be healthier.
On June 7, 1999, with less than 50 employees, Indian Healthcare Resource Center moved yet again, leaving behind our outgrown home of 20 years. This time, our move was to a brand new, modern medical facility of 27,000 square feet and room for future expansion. After moving into our new facility, we decided this was the time we would take the quality programs to the next level and strive for accreditation.
When we were able to build this new building, my goal was the first thing is to become accredited by IHC and to become certified in all of the services that we offer, because we had not been able to do that. And to me, that proves that you have a credibility in the community, and it makes your patients, I believe, feel more confident in the services that you have to offer, because they see that you have a standard that you're upholding. So the first time we were able to become accredited, I believe, was in 2001. That was a very, very proud moment for me and the board and the staff.
In July of 2009, Indian Healthcare Resource Center broke ground on a major expansion and remodeling project. Our goal was to take our facility from 26,000 square feet to 52,000 square feet and integrate all of our health services under one roof. As part of our ongoing accreditation efforts and our strong commitment to quality, Indian Healthcare Resource Center knew we would soon be headed down a path to becoming a patient-centered medical home. Following our electronic health records implementation in 2012, we decided to begin our journey.
The medical home was set up, and the determination to go to the medical home model was strictly for the continuity of care, to enhance the disease management process for our patients, the Native Americans that live in the urban area. And to do that, we've put together teams that it combines physicians, nurse practitioners, physician's assistants, case manager RNs, as well as medical assistants, to ensure that we are identifying all phases of care for the disease. And then supporting that, we have our in-house laboratory, as well as diagnostics and mammography. Our team also consists of the optometry department, the dental department, the health and wellness, behavioral health, and our pharmacy. These departments are critical to completing our team, simply for the fact that if a patient's here for one of those departments and is having a medical condition, we can accommodate that, and they can see their provider that's on the medical team. Ideally, our goal is that you see your provider that you're in panel to every time you come in. That way we have a consistency of care, and if we're not able to do that, then we're able to put you with somebody on that team, whether it be another physician, whether it be a nurse practitioner or a physician's assistant, so that we can make sure that everybody's on the same page, which is going to greatly impact, in a very positive way, disease management process.
I think the most important thing is that this organization be viewed as the vehicle in which Indian people not only have an opportunity to come together, but also an opportunity to get that reinforcement between each other, so they can improve their health, that they see that not only if they have moved here, that there is a structure in this city where they will not only promote culture, but also healthy lifestyle, healthy and emotional, positive lifestyles. I think one of the things that has stayed consistent for Indian healthcare is that no matter what building we've been in, there's always been a draw. And once again, that's pulling Indian people together. People would come by, just stop, because they want to be around their own, and that is still true today. And I think the recent surveys that Indian Healthcare had, where it was 98% of the respondents said that they believed that the staff were interested in them and that they were respected. That says to me that they enjoy being here. Maybe they even want to stop by to visit and talk. So I would always hope that that culture maintains and moves forward, because the most important, what we do best is take care of each other.